Hi, my name's Claire Bamber and I'm a clinical specialist physiotherapist in pain management, and I'm going to talk about the benefits of exercise with you. This is in preparation for your online pain management programme session. I hope you enjoy the session, and I'd encourage you to make some notes as we go through, particularly if there's any areas where you feel like the content applies to you and your life, and try to think about how some of this information might apply to sort of the values that you live your life by, so the things that are important to you that make you tick. We know that exercise, can sound great in theory and a desirable thing to do, but why do it? And what is the reality when attempting to exercise when you're experiencing persistent pain? Because it can be a real challenge. So patients often report that they can identify with the cycle of deconditioning. They can find that as their pain continues, they might find activity levels reduce over a period of time. And this can have effects on both the body physically, which we're going to talk about, and it can also impact on your ability to be able to live your life according to your values. Those areas of life that are important to us, the things that make us tick and make life feel worthwhile. People with chronic pain frequently sort of cut down their activities and avoid doing things that are painful. And unfortunately, this can make things feel worse, because although avoidance in the short term can feel useful, it can maybe give some control to symptoms. But in the long term, we know that pain is felt even though there isn't a healing process going on. So there's no further damage happening in the case of persistent pain. And because that message of pain is no longer sort of a useful one, the avoidance that's happening might lead to sort of guarding of activities. It might also cause people to experience things like muscle spasms. So it might be that attempts to move are met with sudden surges of pain, and perhaps areas that have become what we call deconditioned and tight. And so this becomes less and less helpful in the long term. And the less people are able to engage in the things that they enjoy, often that can impact on mood. And that's a really normal response to life changing as a result of persistent pain. And so the cycle continues. And that reduction in activity is overall feeding into that deconditioning process. So that reduction in general fitness, that reduction in the body being able to do the actions that it's designed to do. It's designed to move and function. Okay, so let's talk about the body systems that can be affected as a result of inactivity, so a reduction in activity. First, if we talk about the muscles, so muscles become weak, they can tire more easily and develop more fibrous tissue rather than new muscle cells, because they're not being exposed to perhaps the normal stresses and strains and activity of daily activities. They become stiffer and so more difficult to stretch. And so they're more likely to go into spasm. So like we referenced before, sometimes it can feel worrying, for example, worrying that perhaps a new pain or a spasm is a new injury or a new problem, but actually it's the body's normal response to movement or stretch when a muscle is deconditioned or tight. Also, inactivity can have an impact on joints. So joints become stiffer and the ligaments that support them can become more easily sprained and injured. And that's because the muscles around the joint have become weaker. So you're not getting that same strength of support. So stiffness of joints and weakness of muscles might also lead to changes in posture, which in turn can put more strain on the joints. So our bodies adapt. So our bodies are designed for function, but they'll adapt to the function that they're exposed to. So if you are in pain in a certain area or throughout the body, we'll tend to protect the area or adapt how we sit and stand and transfer. And consequently, that then has that impact on how those joints and muscles can move and stretch. So inactivity also has an impact on the bone structure. So bones become weaker as calcium can be reduced with inactivity, and that has been found to be more likely to be the case in postmenopausal women. So it's really important, which we're going to look at later, that the body is exposed to some load-bearing activity for that normal bone strength. The cardiovascular and respiratory systems are also going to be affected potentially by a reduction in activity levels. So the heart's a muscle and it needs exercise, just like any muscle in the body. And reduced fitness and activity can lead to reduced stamina, more sluggish circulation, and also that can have an effect on sort of more kind of health conditions such as raising blood pressure, implicating into heart disease and certain cancers as well. As well as those more specific body systems, a reduced activity levels over a period of time can also affect that sense of general well-being. So that reduction in rewarding activities such as hobbies or work can lead to frustration, low mood, and a reduction in self-esteem. Weight might increase as activity levels reduce as a result of that persistent pain. And sleep patterns might also be affected, and we all know how important sleep is. So not having as much activity in a day can reduce that body's natural momentum or drive to be able to get off to sleep. But also pain can impact on the ability to have a decent night's sleep. So if you're waking up multiple times in the night due to pain and having to maybe change position or get up and out of bed, it'd be pretty normal to wake up feeling pretty unrefreshed, and that can be a really common feature of someone dealing with persistent pain. And we say as we do our programme that although we can't remove the pain, unfortunately, by becoming more active with guidance and support and pitching it to a good baseline level of activity, many of these more secondary problems, so these things that are developing as a result of inactivity, can actually be improved. So there is hope. And when we're talking about, when I say benefits of exercise, it's not about necessarily going out for a run or something really specific. It's about activity, a meaningful activity, something that's important to you. So in summary, the aim of exercise and activity is to improve strength, endurance, flexibility, coordination and balance, because we know again that reduction in general activity levels can sometimes lead to an impact on kind of your body's position sense. And also it can help improve the levels of endorphins. So we know that engaging in some form of exercise that gets the heart rate going helps facilitate that release of endorphins, and that's the body's natural feel-good hormones that we can get from exercise. And also it can increase and improve sort of sitting tolerance, the ability to function, engage with meaningful activity. Like we mentioned, the impact on bone density, self-confidence, and also on the circulation. And the aim also would be to reduce consequently any muscle spasm, keeping the joints mobile, try to adapt any postural changes that might have occurred, and trying to really reduce the fear of movement. So improving your confidence to be able to move and knowing that it's safe to move, but pitching it at the right level so that that confidence can raise as you get feeling more confident and stronger to do those meaningful activities that are important to you. And that's what we're going to explore as part of your programme. Also engaging in exercise can reduce body weight. So if you feel perhaps that your weight might have increased as a result of reduced activity, that was something that hopefully would change. And although, like we mentioned, that your pain might not reduce, hopefully the impact that the pain is having on your activity levels and your ability to live life to your values, hopefully that can change as part of this programme. As you can see here, we've got some pretty powerful figures really on the impact that engaging in regular physical activity can have on various conditions. So you can see from the percentage levels that, for example, exercise can have an impact on reducing the lowering the rates of various cancers, heart disease and stroke, as we talked about the cardiovascular system being impacted. Also, it can reduce the risk of osteoarthritis, reducing the risk of hip fracture, again relating to feeling stronger, with improved balance and coordination. It can also, interestingly, have an impact on depression. So there is research that's been done that indicates that engaging in regular exercise, particularly that kind of aerobic exercise that gets the heart rate going, can reduce the levels of mild depression. And they've looked at studies where they're comparing those people that may be taking antidepressant medication for mild depression and those that are engaging in regular exercise, and they can have like really positive outcomes from engaging in exercise. And so that's a really important thing to bear in mind. There's also some evidence to show that it can reduce the level of dementia as well, which is another interesting finding. So you can see here that the evidence is there for some form of exercise to be useful on many levels. However, patients often tell us about the challenges of where to start. So again, this is coming back to this all sounding great in theory and all these positive impacts that exercise and activity can have, but where do you start? And what does regular physical activity mean? And that's going to be different to the individual. So a lot of the research that's been done is looking at people engaging with perhaps 5 times a week and various types of exercise, which we're going to come on to. But that doesn't mean that that's going to be your start point. So we're going to do quite a bit of work to find where your baseline is and make this really personal to you so that it feels worthwhile and meaningful, so it's more likely to be continued in the long term. So we're going to talk about different types of exercise. So it can be really helpful to try and do a range of sort of exercise types. So fitness and health and well-being is comprised of different component parts. So things like stretching and flexibility, strength, cardiovascular exercise, and sort of general well-being or more relaxation exercise can all feed into that general health and well-being of the body as a whole. So if we talk about stretches, we're looking at really trying to increase the length of tight muscles and soft tissues to improve flexibility over time, because we know that if we can try and reduce muscle spasms, and particularly in the case of when you're experiencing potentially a flare-up of pain, we can find that if you have a reduced muscle tension and relaxation, that can be much more easy to manage. And they can be helpful in those stressful situations. And we'd look at doing a range of stretches, which would be a sort of a key foundation to starting to explore movement and exercise. And the current research does debate the effectiveness of purely doing stretches, but if it's done as part of a range of exercise types, it certainly has a place, and it tends to be quite a good place to start as part of our pain management program exploration of movement and exercise. So we look at doing stretches slowly, sustained, so over a period of time, which might change as you work through this and improving confidence and range, and steadily increasing the stretch and focusing on the breath as well. So sometimes we can find that when we start to move or do movements that haven't perhaps been done for a while due to pain limiting movements, you can find that it may be breath hold, but consequently that can sort of feed into muscle tightness. So we very much want to explore those sort of subtle differences between perhaps doing too much and pushing too soon and getting a tension increase, but also doing too little and not feeling like sort of making progress. And the point between those two areas can be quite subtle, and that requires quite a bit of exploration. But slowly your body gets more in tune with its confidence to move and that ability to stretch. So with strengthening exercises, we're looking to improve the muscle strength to help support the body, improve function, and increasing your tolerance for certain activities such as lifting or standing. Muscle strength is really necessary for all of our daily movements and to build and maintain strong bones, to regulate blood sugar levels and blood pressure, and to help maintain a healthy weight. And strengthening exercises are going to be more effortful, certainly, than doing stretches. And it'd be really common to feel a post-exercise soreness. So very much a normal reaction to exposing the body to some form of resistance. And we'll be looking at starting with some functional movements, okay? So again, this is going to be pitched very much to you as an individual as to what your start point is going to be. And it might be that we look at progressing strengthening exercises through repetitions, or the ability to hold an exercise, adding resistance, which might start with using body weight, but then it might slowly be adding on some form of external load. And again, this is going to be very much your decision, and you're kind of with guidance from the physios working with you on the program as to where you start and how you progress this over time. And it might be about adjusting the speed that you do in movement, but we're very much looking at doing these exercises for a reason, so for a functional purpose. So they're not exercises for the sake of it. It's about working the body as a whole and not just working one focused muscle group. We want to work the body as a whole because that's how it's designed to work and move. So with aerobic exercise, this is the type of exercise improving the fitness of the heart and lungs. So we've talked about the cardiovascular and the respiratory system being just as important as working all the other muscles and joints of the body. It helps with endurance and stamina, so looking at being able to do things for longer. And it can improve your general feeling of fitness and well-being. And that's associated with that release of endorphins as well that we talked about. And anything that you notice that gets you out of breath and feeling warmer is going to be raising your heart rate and consequently working your cardiorespiratory system. And as with all exercises, we'll be looking at very much building up gradually. So working to find that baseline level. So that might be 5 minutes of brisk walking. It might be 10 minutes on an exercise bike. They're just examples of things that could be an example start point. And everyone's going to be different at finding their starting level. Lastly, but equally as importantly, there's the use of mind-body exercise. So things like Pilates and yoga can be useful for some people. So that focus on breathing and stretch and potentially relaxation and strength alongside that are really important elements of movement and activity, and really work on that sort of mind-body connection. So being able to tap into this combination of exercise and relaxation and well-being is going to be really important in your journey and sort of exploring where you start with activity. Okay, so here you can see this sort of stepped process in perhaps progressing exercise, and we've touched upon spending some time working out what your baseline or tolerance levels of activity are. So finding that midpoint between underdoing it and overdoing it, and finding perhaps a number of repetitions of an exercise or a time-based period of time that you can engage in doing something so that it's easily achievable and you're confident that you can kind of reach that target. Because if it's achievable and realistic, it's more likely that you can continue with it. And it might be that you spend a week testing where those levels might be. And it is very much a bit of a trial and error process. And then thinking about what you could do on a good and a bad day, because sometimes days can vary. Sometimes you might have levels where your pain peaks a little bit more. So we're very much finding that baseline level that we know is achievable whatever the day. Okay, so sometimes it feels perhaps more of a less is more approach to begin with. And then we'll be looking, as we see in this sort of diagram, this sort of stepped approach. So very much slowly increasing the amount or the challenge of the exercises that you do. And how quickly you do that is quite difficult to judge at first. So it is very much this trial and error process. And if you increase too quickly, you might find that things really can kind of flare up to a degree. But actually, it's about that experimentation, and actually going through that process allows you to evaluate you and your body's response to engaging in activity and progressing it over time. And it's important that we follow sort of your exercise to a plan. So rather than perhaps being guided by pain, very much looking at keeping a record and having sort of targets in mind, durations, step counts, whatever's going to work for you as some kind of way of sort of quantifying or giving a bit of a number or value to the amount that you're going to do, so that you yourself can then see the progression over time. So often we can find keeping a written record of those activity levels as you are kind of monitoring what you might be able to do on a good and bad day, and as you're progressing through, will allow you to give you something to reflect on, so that if you do have a setback, you know where you might drop back towards and where you might build up towards. So it gives you that record and that ability to reflect. So as we've talked about, with all exercise, you have to build up gradually. So we talked about that example of potentially a start point of 5 minutes of brisk walking or 10 minutes on an exercise bike. But everyone's going to be different in finding their starting level, and that's fine. It's about finding your own baseline level. And you can see on the table here how a graded walking program might look. It might be about week by week, adding on a minute to the length of time you're walking, or it might be you look at your step count, but looking at consistency. So that might be a build up every few days or every few weeks, and that's fine. It's about finding what works for you. As you can see here on this sort of journey slide, it's about having some patience and taking a long-term view. It can feel quite frustrating when starting to explore new activities or starting to return towards certain things that you've not perhaps done for a while. It can be really difficult. And so the key is really to think about achieving a consistent approach and persisting with it. Thinking about, solid benefits being achieved over months and years rather than days and weeks. If you put it into context for potentially the length of time you've maybe been living with persistent pain, then it will take time to make some changes or build on changes that you've already been making, because you've been the expert in managing your pain so far. Our program is very much trying to help you explore perhaps subtle changes, new ways to look at things, adding new tools into your toolbox of how you manage and live with your pain. So as we've talked about in your earlier sort of explain pain session, we know that hurt doesn't equal harm in the case of persistent pain, and that when exploring new exercise or working on a program of activity, we need to allow for some form of training pain to occur. And it's working out, what feels a normal response to exercise and what perhaps feels like a new pain. And that's something that you'll explore as part of the program. And remembering that because we know that chronic pain doesn't equal harm, you might find when stretching, you need to perhaps remind yourself that you're moving and lengthening tight and potentially sensitize joints and muscles. So we've talked about in the Explain Pain session about the pain system being very sensitized and wound up for pain. As you start to explore these new movements, you might notice certain changes in your pain levels, and it is about that exploration and becoming more confident in how those experiences feel, and being able to move forwards with confidence, knowing that it is very much safe to engage in activity when it's pitched at the right start point with that slow progression. So it's important to use your knowledge of the threat of pain to be aware of any kind of maybe habitual responses that you might have to pain, and any other difficult sensations or feelings that you might encounter during exercise. So here is a table just exploring perhaps some different approaches to exploring new activity. So the first example is that kind of fight mechanism where you might grit your teeth and force it, thinking, I won't let this pain beat me, I'm going to keep going, I'm going to have a go. But consequently, potentially you might find that muscles tense up, the pain winds up, can be quite quickly and intensely. So it can feel less useful at that point. Another example on the next level is around perhaps the flight example. So we talk about fight or flight in pain management, and that wind up of the nervous system. So perhaps going to do a new movement, you might move back quickly as soon as an unpleasant sensation is felt. So maybe you think I need to be careful, or I might damage myself. And again, that can be quite a normal reaction. But as a result of that, we're not really achieving any of the benefits of exercise and movement. And the pain can continue to feel quite threatening. And then it does have that impact on being able to live that values-based life. So being able to engage in those things that are really important to you. Another approach might be to take that freeze approach. So making no attempt at all, thinking, I can't do this. And again, this can be a really normal reaction to feeling fearful perhaps of engaging with different activity. But consequently, again, you're not going to get the benefits of exercise there. It leads to avoidance that we've talked about. And it might cause difficulty setting goals that are aligned to your values. So being able to have meaningful goals and planning ahead can be quite difficult when we're sort of fearing what might happen when engaging with them. So again, that feeds into that avoidance type behaviour. Some key tips. So we'd look to find that middle path between fight or flight, to perhaps explore the edges of your tightness and pain, and making room for some difficult feelings and sensations that might occur, and yet not responding to any urges to either force into them or recoil for them. So it's finding that soft spot there. As we've talked about, finding your baseline, so that amount of exercise you can do without overdoing it, and building slowly from there. Trying to avoid comparison with others. This is all about you. Our bodies are all different. Our pain experiences are different. And it's important that the activity you engage with feels important to you and your needs. And try to treat yourself with kindness. That is, be patient and gentle towards yourself, and yet be firm and disciplined, so that you do feel that you are working towards some goals aligned with your valued areas. So what are your thoughts and expectations about starting or increasing exercise? Try to think back to a time when you've tried to be active or take part in exercise in the past. And what did you experience in your body? Have a think about any questions you would like to be answered regarding pain and activity and exercise. And we'll come back to these points in your online session with the clinicians. So do feel free to take some notes and make sure that any queries you might have are really addressed in your session with your therapists. So please do write down any notes about deconditioning that you recognise in yourself, and how it maybe fits in with any perhaps functional difficulties or interferes with valued parts of your life. So on referral to physical activity schemes, so please speak to your clinician or your GP or practice nurse if you'd like to explore any physical activity referral schemes in your area. They're different in each area, but most areas of the country do have physical activity schemes in place whereby you can be referred by a health professional to access some support in perhaps your local leisure centre, to be able to engage in exercise programs, whether that be classes, getting in the gym, swimming, anything that might be of interest to you. And often they do have programs that are designed for people who are either dealing with persistent pain or many other health conditions, and they're qualified professionals that are there to help you. So if that might be something that you want to explore, perhaps as you're coming towards the end of a program, if that's for you. So it's not for everybody, but if that's something that interests you, then do have a chat with your physio on the PMP, and they can do a referral for you. And sometimes it's a self-referral, so they'll be able to talk to you about that as part of your session. Here are some links to some different websites to access exercise. Please also refer to the exercise videos that are part of your online pain management program, and you'll be doing some sort of experiential, so some exercises as part of your sessions as well. But this is a list of resources such as chair-based yoga, sort of gentle approaches to exercise that if you like to access at home, that they're available. They might be ones to come back to as you're working through the program. So it might be initially about exploring your own exercise, but if you feel you're kind of building up and want to explore perhaps doing a class or a snippet of exercise to have some variety, then these can be good go-to resources to use. Okay, so thank you for listening and engaging with the session. I hope you found it useful. And as we said earlier, please do have some notes ready for your online pain management program session so that you can really feel that you can get the most out of the session and have any questions that you might have answered for you.